Your medical condition may require a backup supply of oxygen too. Stationary cylinders are generally used in addition to oxygen concentrators to provide a backup source of oxygen in case the equipment fails or a power outage occurs in your area. At other times, cylinders are used for pediatric patients or for patients who need high liter flows of oxygen for short periods of time. Stationary cylinders are for home use only and should not be transported in personal vehicles. Much like our portable cylinders, stationary tanks have a regulator. However, they are not attached in the same way. In most cases, your delivery technician will attach the regulator for you when it's delivered. If it becomes necessary for you to change the regulator on a routine basis, you or your caregiver will receive further instruction from an Apria representative. When using the stationary tank, open the tank by turning the valve handle counterclockwise. Set the flow as prescribed by your doctor and fit the nasal cannula or the oxygen mask so that it's comfortable. When you are finished using your oxygen, remove the cannula or mask. Then, close the cylinder valve by turning it clockwise until hand tight. You don't need to use any tools. This will stop the flow of oxygen. If your regulator is equipped with a flow meter, when both the pressure gauge and the flow meter register 0, turn the liter control knob counterclockwise until it is hand tight. If your regulator is not equipped with a flow meter, turn the liter control knob counterclockwise until it is at 0. If you are only using the stationary oxygen tank for backup, I recommend you keep the tubing at the tank and still in the bag so it stays clean and ready to use. For some patients, empty or used cylinders are exchanged for full ones by our delivery technician on a regular schedule. In most cases, patients use the cylinder as a backup source of oxygen only and will order replacements only as needed. When the needle in the contents gauge enters the red zone, it's time to order a replacement cylinder. If you feel that your oxygen supply will not last until your next delivery, please call your local Apria branch at least 2 days before the date you expect your supply will run out, so that your branch may change the date of the delivery.